Hearing your child wheeze can be quite alarming, making you wonder if it is a passing sniffle or something more serious. It is natural to feel worried when your little one is struggling to breathe, and knowing when to act is key. When your child experiences allergic wheezing, it is always a good idea to have them evaluated by a doctor. While not every instance requires an emergency room visit, any new or worsening wheezing, especially if it is allergic in nature, warrants professional medical attention to ensure your child receives appropriate care. The reason wheezing in children is taken so seriously is due to their developing respiratory systems. Children have much smaller and narrower airways compared to adults, meaning even a small amount of inflammation or mucus can significantly obstruct their breathing. Allergic reactions can cause airways to swell and tighten, leading to that characteristic whistling sound. A doctor can assess the severity, differentiate between allergic wheezing and other causes, and help prevent minor issues from escalating into more serious conditions like an asthma attack. You should definitely seek immediate medical attention if your child is experiencing significant difficulty breathing. This includes rapid or shallow breathing, visibly working hard to breathe like their chest or neck muscles are pulling in, or if their lips or face look bluish. These are signs of respiratory distress and requiring urgent care. Additionally, see a doctor right away if your child's wheezing is new, gets worse despite using prescribed medications, or is accompanied by other concerning symptoms such as extreme tiredness, a high fever, or a severe cough that does not go away. If your child has never wheezed before and suddenly starts, a doctor's visit is also essential. Understanding the difference between allergic wheezing and wheezing from an infection is a crucial insight. While both cause similar sounds, the underlying triggers and necessary treatments can vary greatly. Your doctor might suggest specific allergy testing to identify triggers or discuss developing an allergy action plan, which is a personalized guide for managing your child's allergic reactions. They may also talk about tools like a peak flow meter for older children, which can help monitor lung function at home. Ultimately, prioritizing an evaluation for your child's allergic wheezing offers immense peace of mind and ensures they receive the most effective management. Early intervention can make a significant difference in controlling allergic reactions and supporting your child's healthy, active life. It is all about being proactive and informed to help your child breathe easier.